Hello, I'm Liz Gwyther. I'm the CEO of the Hospice Palliative Care Association, and I thought that I'd give you some background information to the HPCA strategy. In August last year, the board, the executive and senior staff members met to have an interim review of the HPCA strategic plan. The strategic plan has as its foundation good governance, ethical practice and support for our member hospices and palliative care organisations. In order to achieve our strategic objectives, we clearly need a strong fundraising foundation and we need good internal and external communications to make sure that we are all speaking the same message and on the same page with regard to the HPCA strategy. It also helps our funders and people who would benefit from palliative care to know what is available for them. The first pillar of the HPCA strategic plan is advocacy, influencing policy and community awareness. Hospices and HPCA have for many years been strong advocates for palliative care, making the point that people need good quality care when they have serious illnesses, and that the family and the patient need care and support together, and that this care is provided to the individual patient depending on his or her needs. The advocacy has borne fruit, and HPCA staff have been members of a national steering committee convened by the Minister of Health to create a revolution in healthcare through palliative care. The steering committee, with the writing team from the Department of Health, produced and reviewed and updated a national policy framework and strategy for palliative care. This document was presented to the National Health Council by one of the steering committee members, Dr. Mpora Chikana Maloko, and the National Health Committee approved the policy for palliative care. So our role now in advocacy as HPCA, as member hospices and the provincial associations is to call for provincial governments and health facilities to implement the recommendations of the national policy. The problem is that we don't yet have a budget to implement the policy. But we do know that the Medical Research Council has identified that palliative care, if implemented countrywide and the home-based care paid for by the government, it would still save the national health budget 3.6 billion rand per year. So we have a good foundation, and not only for quality and attention to each patient, but also for cost saving. So the influencing policy has been an important part of our work, but so has the communication of this. And HPCA are part of an international news platform, eHospice, that collects news and views and interviews about palliative care to inspire people with this particular discipline and to know that help is at hand for patients who need this care. The communications team also makes sure that these stories are on our website, in traditional media and in social media. We have a particular project, the Patient Power Project, that uses the voice of people who've benefited from palliative care to promote palliative care so that people don't feel afraid to come to hospice or to ask for palliative care. And in fact, recent research showed that in patients with lung cancer receiving palliative care alongside their oncology care, as compared to people having the normal oncology treatment, that they had better quality of life, lower rates of depression, and in fact lived a few months longer than the people who didn't receive palliative care. So we're using the phrase to promote hospice work, that hospice helps you live well for longer. We do have a national advocacy committee with representatives from each province who have this role of making sure that provincially and at district level, and for hospices to be talking to their district health management teams to make sure that palliative care is integrated into facilities and that the hospices are providing the advice and the mentorship around palliative care. Our second pillar is that of education and training, which builds on the hospices being centres of excellence in providing training. And we also have a national education and training committee with representatives from most of the provincial associations and representatives from the different courses that we convene. The national policy framework identifies that hospices and HPCA have been at the forefront of palliative care education in this country since we first started as hospices in the 1980s. Palliative care education is the foundation for the provision of palliative care, and HPCA has a number of standardized curricula and courses that we teach regularly. The certificate course in palliative nursing is the intermediate course for nurses throughout the country, and this is run annually at our Centres for Palliative Learning, and we encourage all nurses to undertake this training. We've also been very active, particularly in KwaZulu-Natal and in the Western Cape, in presenting the Introduction to Palliative Care, a 5-day or 40-hour course to make sure that all healthcare workers are trained in basic palliative care. And this has come with funding from the Department of Health in KwaZulu-Natal and from the Department of Health in the Western Cape. There is a skills development budget that the Department of Health has. And even if there's no budget yet for the services for palliative care, there is a budget for the training of palliative care. And the more Department of Health officials who are trained in palliative care, the more champions we will develop for palliative care to be implemented and integrated across the country. So then we come to the third pillar, which is quality assurance and accreditation. The HPCA self-assessment tool is used by hospices and by the provincial associations to assess people who have applied first for new membership to the provincial associations to come in as a one-star hospice. The hospices then can use the self-assessment tool to develop further and become 2-star or 3-star, 4-star hospices. There is a national accreditation committee with an accreditation champion in each province, and the accreditation champion will help the hospices and member organizations develop and put all the policies and procedures in place to progress along the star rating. And when a hospice has reached 4-star with a pre-COSASA assessment, then the accreditation champion will recommend that COSASA comes to do an accreditation visit so that the hospice is then designated 5-star and has a certificate from COSASA. It is so important that our non-governmental organizations, our hospices, have the credibility of an accreditation certificate. When we think about the tragedy with the mental marathon in Gauteng, when patients were transferred from the Life Isidimeni Hospital to unlicensed NGOs, there was unfortunately significant loss of life. And this cannot happen again. We have to make sure that hospices and CBOs, not only in the palliative care setting, but any healthcare setting, are registered and licensed and accredited. So we're working with the Office of Health Standards Compliance to see if we can assist in putting together standards of management, governance and care for community-based organizations. This will also give an opportunity for hospices who we are promoting as centers of excellence to mentor health facilities to develop their palliative care programs, but also to assist community-based organizations in integrating palliative care and to be able to conduct surveys and make sure that they are also accredited when this comes into being. Monitoring, evaluation and reporting is an important aspect of hospice management and HPCA planning. The hospice data management system or household data management system helps capture all the work that is done in people's homes. And this is something that both our funders and the government are unaware of, the significant work that is done. But the data that we get from the HDMS is able to promote the work that our hospices do. The HDMS community of practice has been looking at how we utilize this in more efficient and effective ways, making sure that there are good management reports going back to the hospices, and that as the National Health Insurance comes into being, so these 4 pillars, together with tight, efficient management of HPCA, help us to create opportunities for funding for hospices, for sustainability of hospice and HPCA, and to realize our vision of quality palliative care for all.